Alrighty. So, hello. We're 35 seconds into the call, and just remember to take the mute button off. Also, trying to share my camera, and for some reason, my computer is struggling trying to find me. So, anyway, welcome to Anatomy and Physiology and medical terminology. There we go. Hello, everybody. So, there we go. Hello. So welcome. Rough first minute of the conference here. Got my mute off, got my camera on, so here we go. Medical terminology and anatomy physiology. It's very important to learn medical terminology if any of y'all are planning on going into the healthcare field, because medical terminology, it's a whole new language. I'm sure a lot of y'all that are here on this call are bilingual already. I know a lot of my students are um, bilingual with Spanish and English. Well, now you're going to be trilingual with medical terminology. Medical terminology, it is, like I said, a whole different language. It helps your life so much more in anatomy, physiology. It helps you in the medical field because you can literally break down the word and figure out what something is. So, we just kind of touch on it in this class, very, very basic, but I highly encourage you to, if there are other courses you can take on medical terminology alone, or if you can even just study it on your own. You don't have to have a class. You can go out on, good gosh, we've got Google now. You can learn anything on Google. I learned how to use a cordless drill with through Google. My husband wasn't home, so I thought, all right, I need to use it. I need it now. Let me figure it out. And guess what I did? So, I am your instructor. I am Dr. Terry Minwer. Um, I have been, this is, I think, my fourth or fifth class that I have taught at FTC. They've all been different classes, but they've all been in the healthcare related field or medical field. That is because I am a nurse, I'm a registered nurse. I have a doctorate in education because I've been a nurse educator for about 5 or 6 years. I'm also just a couple months shy of getting basically a second master's degree. The first master's was in nursing education. In June, I'll graduate with a second master's in as a nurse practitioner in adult gerontology. Again, medical terminology, gerontology, that's study of the older population. Pediatrics, we know pediatrics, peds are children. We call Jerry's. Jerry's are the elder population. So I'm not doing family nurse practitioner, which includes pediatrics. I'm doing adult gerontology, which is actually ages 12 and up. Um, so this is my my passion and my love, and medical terminology, anatomy, physiology. It is a passion. If you're planning on continuing into the healthcare field, this isn't a course just to memorize and dump it at the end of the course. Oh, took my final exam. Now I'm just going to dump what information I have. That is not what you do. This, you have to know it. I did not have to even really prepare for this course or for this lecture tonight because I just know it. It's something that I had to learn in my training as a nurse, and you have to know it. So if you plan on being in the healthcare field, you need to take this information to heart and and really learn it, not just memorize. If you've never, if you don't have a lot of experience with anatomy physiology, it's a lot. Fortunately, this class this class is very fast, and it's not as deep in depth as some courses. So it's really a great course to start off with in anatomy physiology because it kind of gives you knowledge. But if you took another course in the future, it goes a lot deeper. Now, I'm not saying that you have to have the really deeper stuff, but you do need to know the medical keep saying medical terminology. You need that too. Anatomy, physiology. This course, so it's fast. It's 4 weeks. I'm sure you are all familiar with that. You know how fast these courses go. It's a lot of information. It's a lot of knowledge in a very fast amount of time. Don't procrastinate. Don't get behind. Um, it's so much easier to stay on top of your work than it is to try to catch up on your work. I've seen some students that wait, it seems like to week 4 before they start doing all their work. First of all, that's got to be exhausting. It's a lot of information. Second of all, that's cramming. When you cram, you don't remember it. You're learning enough just to take a test, and then your brain is not absorbing the material. So you really need to take your time, take this, do your work every week, and learn the material. Don't cram at the last minute. Another reason is for me because um, if you don't do all your work till week 4, guess what I'm going to be doing all of week 4? I'm going to be grading your work, and that doesn't make me very happy. I am very busy. I am available to you all. Send me a text. You all have my number. I sent you all a text today, and I am really thrilled to say we have a big class. We have 46 students in this class, which is a huge class, and 41 of you responded to me saying you were going to be in the class, which I mean, I've been teaching for about 6 years, and I don't think I've ever had results like that. So kudos to you. That tells me that y'all are motivated, you're on it, and we're going to have a really good 4 weeks together. That's amazing. I can't even believe that 41 of y'all responded. So kudos to you. Um, send me a text if you have questions about anything. If you have an issue, I may not respond super quick. Sometimes I'm really quick responding, but um, please understand that I also have a couple of other things going on other than teaching for FTC. I teach this class for FTC, yes, but I also teach at another school. I teach a nursing class, and it's not online. That's on campus, and that's just 1 day a week. So that's not too bad. That's just actually Wednesdays. And then the big one is I work at a hospital full time, and I typically work Friday, Saturday, Sunday. I work night shift, 7 p to 7 a, Friday, Saturday, Sunday. And so then, of course, you know what I'm doing Saturday morning, Sunday morning, Monday morning. I'm sleeping because I've been up all night caring for patients. So, oh, and then of course I'm in school as well. I think I just said I graduate in June. So somewhere in there I have schoolwork. So, if I don't answer you immediately, it's not that I'm ignoring you. I promise. It's probably because I'm, well, probably sleeping. So, just bear with me. Give me some time to get back with you, and I promise you I will. I know some people have had some technical issues um, this evening or today. I did get a notice that Cengage has been was down. My understanding is everything's back up. So if you were having some issues with the class earlier today, it's probably not you. It's probably the system. There is. Excuse me, on Canvas. I'm not really sure if I know how to share my screen. It's got to be here somewhere, but um, on Canvas, if you're having any kind of technical difficulties, you've got your courses in the main screen, but to the far left-hand side, if you look, that's where like your Canvas email is. You'll have your inbox. So if you look there, there's also one that's called think it's called like help or technical help. Hang on, let me pop over there and see what it's called. Help and services. It's called help and services. If you go through that, it actually gives you emails and phone numbers to support um, for like technical support. You can reach out to me, but honestly, technical support wise, all I'm going to do is be the middleman and relay your information to support. And then they come back and ask me a question. I'm going to have to go back to you and ask you the question. So that's just going to be a delay. go ahead and just go straight to support yourself, and it'll definitely speed up the process. So, let's see. This week is week 1. Your first discussion board post is due tonight. Your discussion board posts are due on Tuesday nights, with the exception of week 4. It's due on Monday night, and that's because that's a short week. Your last week is a short week. So, you need to respond to the discussion board post. That's your initial response, and then you have until the end of the week, which is Saturday, to respond to 2 classmates. Um, the discussion board posts, I have already posted some information in each one, mostly videos that go over the concepts that we're learning that week. And the videos I've posted, they're short. So I don't think any of them are over 5 minutes. I know that I tend to lose focus and concentration on a long video. And 5 minutes is about the max that I can stay alert for. So most of the videos I've tried to pack as much meaningful information in as short amount of time as possible. So, meaning under 5 minutes. I would suggest that each week you do watch the videos. The videos are very helpful. They go along with what you're learning for the week, and they will help clarify any information. Especially, it'll help with the discussion board post because it has information pertaining to the discussion board post, and I've done that for each week. So please do watch those. What else? Rest of your assignments for the week are due on Saturday by Saturday at midnight. Typically, Sunday is when I will do the grading for the week. So I'll wait till Saturday to give you all time to make sure that you've submitted all of your assignments, and then I'll start grading on Saturday or Sunday and probably Monday, depending on how I feel, because like I said, those are my work days. Um, Next week will be your midterm exam, and that is due on Thursday. The following week would be week 3. Also your conferences are on Tuesday nights, except for next week. I had it set for Tuesday night, but then I heard from the powers that be that that's Valentine's Day, and that people need to be out with their loved ones. So I've been with my husband for 36 years, so every day is Valentine's Day. Sorry, it was a joke. So I didn't even think about Valentine's Day. So I did move the conference to Monday night. So next week it will be Monday night, and then Tuesday nights after that. The last week, week 4, like I said, your discussion board post will be due on Monday night. The conference will be Tuesday night, and then your final exam is Wednesday night. And then Thursday is the last day of class that week. So all of your assignments must be in by Thursday at midnight in week 4. I don't know what the date is. Sometime first part of March. Let me look at my calendar real quick. It would be 4. That would be March 2nd. That's what I thought it was. So by March 2nd, midnight, make sure you have everything done because the course will close. And I have to turn in grades by noon on Friday, March 3rd. So please make sure that you get that all done. All right, so here we are, 15 minutes into our first lecture. So let's go ahead and talk about the cardiovascular system. All right. I'm going to skip through the objectives. Functions. Now, there are a lot of slides in this, so I'm going to zip through it pretty quick. And some of them I may just skip because they're not really that as important, I guess we should say. Cardiovascular system basically is your heart. That's what we usually think about when we say cardiovascular system, right? But we say cardio is the heart's, vascular are all your blood vessels. Again, cardiovascular, that's your medical terminology. Anything cardio, card, that means heart. Good way to think about it. Think about the Queen of Hearts. So think of Queen of Hearts, think of your card, that's your cardio. Vascular, that's just like the veins and arteries, that's your vascular. Um, these structures all work together to pump blood to all your body tissues. Your heart is just a pump. That's all it is. It's just a pump. The whole function is just to pump that blood throughout your body. Now the blood is a tissue. Blood is its point of the blood. The purpose of the blood is to transport oxygen and nutrients to the body tissues, but it also picks up waste products and brings those waste products back either to the kidneys or the lungs. Here's some different structures of the cardiovascular system. You've of course got your heart, which says it's a hollow muscular organ. It is a muscle, just plain and simple. It's between the lungs. People always want to say it's completely on the left side. It's actually kind of in the middle, little bit on the left side, but it is really and truly, it's in the middle towards the left. Your lungs, you can see that your left lung is shaped a little bit different to make room for your heart. Um, your heart's going to be about the size of an adult. It's about the size of two fists together. A child is about one fist. Apex of the heart is actually at the lower tip of the heart. You have the different structures around the heart. You have the pericardium. Now, again, there's that word card right in the middle. So that means what? Heart. Peri. That's medical terminology, means surrounding. Okay. Peri means surrounding. Heart. Cards means heart. So what does that tell you? Pericardium does what? It's a sac that surrounds the heart. It basically just literally means surrounds heart. Um, you have pericardial fluid. That's just fluid in between that little sac and the heart. It just gives its lubricant um, so that it doesn't cause friction. You have the different walls of the heart. You have muscles. It's muscle tissue. So you have different layers of that muscle. You've got your epicardium, which is the external layer. Um, external layer of the heart, but the internal layer or inner layer of the pericardium. So that's that layer that goes between the pericardium, which surrounds the heart, and the first layer, the outside layer of the heart. So it's kind of like this. Myocardium. Now, medical terminology, myo means muscle. So, muscle, myocardial muscle. Look at that. How about that? Heart, muscle, cardiac muscle. The endocardium. Endo means inside or internal. And so, of course, there's your inner layer of your heart. It has the direct contact with the blood. So in the diagram over here, you can see the different layers. Nice little, all the different layers. You got your endocardium, myocardium, and your epicardium. These make up this outer layer here of your heart muscle. Your heart has four chambers, right? We've got an atrium, a ventricle, and then here's your left atrium and left ventricle. Four different chambers. The atrium is the top two layers. They're divided by a septum. And the ventricles, again, divided by a septum. Now, think about your discussion board post tonight. It talks about the baby that has a hole in the septum, right? The walls in between the ventricles is much thicker than that of the atrium, and that's because, again, this is a muscle. And what happens when you work out muscles? They get bigger, don't they? You work out your biceps, they get bigger. Well, guess what? Parts of your heart that works harder, the muscle is going to be bigger. So your ventricle works harder than the atrium. In between the atrium and the ventricles, let me go backwards. See and this is probably in another slide, but I'm just going to go ahead and do it because I feel like it's out of order. You have this big, huge vein right here. See, anything blue is, is deoxygenated. I mean, there's no oxygen in it. This big, huge vein, and it's called your vena cava. It runs all through your body. You have an inferior vena cava and a superior vena cava. Again, medical terminology words. Superior means above, top. I feel superior to you. That means I feel above you, superior. Inferior is below, the lower portion. I feel very inferior to you. I feel below you. Inferior, superior. That's what they mean in medical terminology. So now you have your vena cava. You look at the screen, big, huge, fat vein. You've got your superior vena cava that all the blood from everything in the top part of your body, it all goes to that superior vena cava. Think about it as being a major highway. Think of it as it's the I-95 of your body. So everybody, all the little roads bring their blood to that big old, I-95 of your body, basically, and brings from the top part of your body, they take superior vena cava. Anything the lower part of your body goes into the inferior vena cava. Now, that vena cava brings all that blood. Now, this is unoxygenated blood, and it has waste products in it. It has carbon dioxide. It could have like lymph fluid in it. And it's going to come up here, and this vena cava dumps this unoxygenated blood into your right atrium. So all that unoxygenated blood goes right here in this big chamber right here, this right atrium. It's going to go through a valve. The valves are literally just little doors. And they go, and that's actually your heartbeat. You hear the boom, 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 boom. That's these opening and closing. That's that valve. Boom, 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 boom. So you got your first valve right here. It's your tricuspid valve. It's actually called tricuspid because it's got three little, like they're called leaflets, like three little leaflets that's almost like a little flower. I don't have three hands, but if I did, you'd see that there's an extra little one over here that opens as well. So it's called a tricuspid because tri means three, right? That opens up, and this blood goes here from your right atrium. It opens up through the tricuspid valve, dumps into your right ventricle. Your right ventricle then will go through another valve right here. It's called a pulmonary valve. Pulmonary, anything with pulm, like P-U-L-M, pulm means lungs, the pulmonary system. Um, that is medical terminology for lungs is P-U-L-M, pulm, pulm. So it goes through your pulmonary valve. And where do you think it goes? Takes the pulmonary valve. Well, my guess would be it's going to go to your lungs, right? So now this unoxygenated blood, it's coming in from your superior vena cava, inferior vena cava, dumps into your right atrium. It's going to go through your tricuspid valve right here, comes in here. Your right ventricle is going to squeeze it. It's going to send it through this pulmonary valve, go here to your pulmonary artery. It branches off to two different ways. Why do you think it goes two different places? Because you have two lungs, right? So some of it's going to go to the right lung, some of it's going to go to your left lung. It's going to go into your lungs. This blood flow is going to go into your lungs. It's going to travel all the way down through all the little microvascular. Micro means small vascular system, all the way down the bottom of your lungs. There's these little things, there's little grapes, like clusters, like grapes. They're called alveoli, and they're very thin walled. And that's where a gas exchange takes place, meaning when you take a breath in, you're breathing in that oxygen. It's going to go all the way down into my alveoli, my little clusters of grapes at the bottom of my lungs. And it's very thin walled. So the gas is going to be able to go through that thin wall. Now, my carbon dioxide, which is what is the waste product, it's going to go into the lungs. The lungs have taken in oxygen. It's going to go into the blood there. Now, I'm going to breathe out what that blood just took from my heart the waste products, and then breathe it in. Now that oxygen's going to go into that blood, and now my blood is now oxygenated because I just breathed in and I just put oxygen into it. So now it's going to come back into the right atrium. No, wait a minute. Left atrium. So now we've got this blood just came from the lungs. See right here, left pulmonary veins. Now we have in this spot right here, your left atrium. Now we have oxygenated blood. So oxygenated blood, well, what do we need to do with oxygenated blood? We need to send that out to all the rest of our body for it to get oxygen, right? So it's going to go through another valve. Now, this valve is called your mitral valve. I'm sure a lot of y'all heard talk about the mitral valve. Oh, I have a heart murmur. It's my mitral valve. It's also called the bicuspid valve. So some people say bicuspid, some people say mitral. The reason is because it's considered it's one of the two AV valves, the atrioventricular valves. And remember over here we have the tricuspid, so this is the other AV valve because it's between the atrium and ventricle, and it only has two leaflets instead of the three. It only has the two, so it's considered a bicuspid valve, but it's actually the mitral valve. Either word works. So now this oxygenated blood goes down here into your left ventricle. This left ventricle is going to give that nice little heart muscle, is going to squeeze it. It's going to go out through your aortic valve. Aortic valve is going to be right here. And that's because it's aortic valve controls the blood flow that's going to go up in here into your aorta. That's the red thing. Remember, red is oxygenated. So now we've got this oxygenated blood. It's going to go up here into your aorta. And see up here, this is an aortic arch. And so guess what? See all these little things go up and then they're going to go down. This is what's going to deliver oxygenated blood to your tissues. So part of it goes up to oxygenate your brain, and part of it's going to go down to oxygenate everything else, your stomach, your kidneys. And it's just a big loop. That's all it is. It's just a big loop. And I do a loop in front of my camera. You'll see that we have a slide that represents that really well. And it just has this whole cycle of blood that goes throughout your body, the oxygenated and get to bring to the tissues. The tissues dump off their waste, and then the deoxygenated blood that has all the waste products goes up. That's represented in the blue. That's the vena cava. Goes through the lungs, dumps it out. Lungs brings in good stuff, goes into the left side of your heart, left side of heart pumps it out to your body. And it's just a circle, a big, lovely circle. Oh, here's the lovely valves we were just talking about. See there we go. See, you can see the um the three leaflets there. That's the tricuspid. There's your mitral valve. You have your excuse me, aortic valve, and your pulmonic or pulmonary valve, as they call it. Um, Pulmonary circulation, that's where the blood flow goes to the lungs to do the gas exchange. Gas exchange, getting rid of the carbon dioxide, bringing in the oxygen. And then systemic circulation that's where the circulation that goes throughout the body to drop off the oxygen and pick up the waste products. There's that lovely diagram that I mentioned. This is so beautiful, and it helps really understand the whole point of the heart. Like I said, it's just a pump, just a pump. Here it shows this side goes up, all the unoxygenated coming in from your vena cava, going to your heart. It's going to go here. We're going to go to the lungs. We're going to have a little gas exchange. Now we're going to be all nice and oxygen rich. We're going to come back to the heart. Heart's going to pump it out to the aorta. It's going to go around, drop it off to all the different body organs, and so on, and so on, and so on, and so on. It's quite fascinating. Sorry, I need to get a drink of water. All right. So Your heart has, it's almost like two different systems. My sister always called them um, the plumbing system and the electrical system. So I know her husband had heart issues and he had different cardiologists, and the different cardiologists specialized in different things. And she called one of them the plumber and one of them the electrician. Um, and that sounds silly, but honestly, it really is what they do. The plumber deals with the blood flow, right? He's making sure that this blood flow is going through this heart, that there's no issues with the blood flowing through the heart, kind of like water going through pipes, right? So he's the plumber. Now, your heartbeat is an electrical signal. It's a, electrical volt that's making that heart squeeze. It just squeezes and opens up, relaxes, squeeze, relax, squeeze, relax. And it's doing that because of this electrical conduction. It's basically giving it a little zap, zap, and it's going to squeeze, opens up. Well, what makes it do that? So you have these different nodes in your heart, and this is actually what generates your heart to beat. And the first one is called your SA node. So it's right up here at the very tippity top. See right here? It's up at the top of your right atrium. That is your SA node, sinoatrial node. That is what generates your heartbeat. That is what gives us our normal heartbeat. Normal heartbeat is from 60 to 100. That's considered a normal heartbeat. Normal a normal rhythm, well, normal heart rate. Anything slower than 60, let's say it was only about 40, that would be considered Brady. That's another medical terminology word. Brady means slow. Bradycardia. Bradycardia, slow heart rate. So if you are considered you have bradycardia, your heartbeat is lower than 60. Tachy is the word for fast. If you have tachycardia, that tachy means fast. That's over 100. That would be those of you that have the 120 beats per minute heart rate. That's tachycardia. Well, this little node right here, sinoatrial node, gives us our um, regulates that beat. That's what causes that electrical jolt that makes the heart contract. Sinoatrial node is the normal 60 to 100 beats per minute. Now, let's say that sinoatrial node decides not to work anymore. Matter of fact, in some elderly people, it's something called sick sinus syndrome, SSS, sick sinus syndrome. And that is where the sinoatrium, which gives us the sinus rhythm, is not beating like it should. So you have a backup. You got an automatic pacemaker right now. Every one of y'all have a pacemaker. It's automatically there. And it's right here. It's called your AV node. How about that? It's because it's between your atrium and ventricle, right? Your AV node is your backup pacemaker. It's going to give a little bit slower heart rate. It's going to give a heart rate of about 40 to 60. So, for those people that chronically have a really slow heart rate, like 40, I know my mom is 93 and she's like, "Oh, I'm in such good shape. My heart rate's only 50 something. That's my normal heart rate." And I don't have the heart to tell her, don't have the heart to tell her that that doesn't mean she's in really good shape. It just basically means that most likely her sinoatrial node is not working anymore. Now, athletes, professional athletes, professional football players, they're in such amazing shape. Their heart muscle is so big and strong that it doesn't need to beat as often because the whole point of that heart contracting is to push blood through the body. Well, you got a really strong push. Wow, it doesn't need to do it as often. So very, very conditioned athletes have a slow heart rate and there's nothing wrong with them. It just means that their heart's in amazing condition. So my mom is just a little confused thinking that, you know, that she's in good condition because her heart is normal heart rate is slower than 60. So anyway, so there we go. The AV node, that's your um, backup pacemaker right there. Now, okay, what if this little guy decides not to work anymore? Well, you still have some other um, electrical conduction within your heart that will back you up. So now, see that electrical conduction is going to go. It's going to travel right down here, the septum that separates the two sides of the heart. You've got these little. You can see there are two different connections. They're called bundle branches. You have a right and a left bundle branch. So it's called the bundle of his, and then it splits off into your bundle branches. That also gives out an electrical impulse that will be a backup heartbeat. That one's even slower. This one up here, your AV was 40 to 60. This one's going to be about 30 to 40. It's a little bit slower. And then even that heart rate will still, or the electrical conduction will still travel up the different sides of your heart up in here into your Purkinje fibers. They're called Purkinje fibers. They all innerviate right up through here. These Purkinje fibers, that gives you like a 20 to or 10 to 20 heart rate. This was, I think I can't remember what I said. Bundle of his, left bundle branch, 20 to 40, and then this gives 10 to 20. So at that point, your heart's not really beating much at all, but at least it's got a little bit of juice there. So those are definitely, you have some backups here. Just some little trivia here. Your Purkinje fibers are like little fibers or little strings going through your heart, and that's when they say, "Oh, you're pulling on my heartstrings." Well, there's your heartstrings right there. It's your Purkinje fibers. When you have an EKG done, that it is measuring the electrical conduction through your heart. That's all it does is measure the electrical portion. It doesn't measure anything with the blood flow. It is literally just the electrical conduction. Ah, nice that I talked about EKGs because here's a picture of an EKG. I am not going to go through this completely because we don't have enough time. And just real quick, each one of these different parts of the EKG represent a different portion of your heart rate. Like the P wave is the atrium contracting. Atrium is smaller than the ventricle. This QRS complex right here, it's bigger because that's your ventricles contracting. Your ventricles are bigger, so they're going to have a bigger blip. And then the T wave is basically everything just kind of relaxing to get ready to do it again. When EKG, the way we tell whether it's normal or not is we actually do measurements. These different things we measure the P wave, we measure the QRS complex, and this can tell us like if there's a heart block. Because if this P wave takes a really long time, like if it started here and ended way over here, that would tell us there's some sort of heart block going on. So that's all I'm going to say about that. Okay, blood vessels. We've got different blood vessels. I said the vascular system. I can't talk. Arteries are very large vessels that carry the blood away from the body or away from the heart. Jeez Louise. Away from the heart. This arteries carry oxygenated blood. Always remember that. Arteries are oxygenated blood. When your heart sends it out, the blood through that aorta, remember, and they had the aortic arch, and that was the oxygenated blood coming out down the aorta. Aorta is huge. It goes all the way down into your down your body. It's a very, very large artery. Um, and then all the little arteries that come off of it all carry the oxygenated blood to the tissues. The tissues dump the um, carbon dioxide and the waste products, and it goes into the venous system. So veins are unoxygenated. The veins take the blood back up to the heart and into the lungs. The arteries take the blood away from the heart to oxygenate the tissue. So remember that veins have no oxygen. Arteries have oxygen. You have the aorta goes down the middle. You may have, maybe not, have heard of some people say a triple A. Oh, I've had a triple A. And you think, oh, yeah, I've got that too. When my car breaks down, I call them. Um, Different thing. This one is a abdominal aortic aneurysm, and that could be an aneurysm in that abdominal aorta, and that's actually very dangerous. If that aneurysm bursts, then you basically die in about 2 minutes. So a lot of people do have them. They're monitored and measured quite often to make sure that they don't get dangerously large. But that remember the aorta and arteries are have oxygen in them. Bright red oxygen-rich blood called arterial blood. There it talks about the aorta again. Begins from the left ventricle of the heart and goes all the way um, down your abdomen, and everything branches off. Again, it's like the I-95 coming down south, and then you got all the roads that branch off. Your carotid arteries, very important arteries. They're on each side of your neck. You've got your jugular veins. They're deeper. Jugular vein. Remember, vein. So what does that mean? That means there's no oxygen in it, right? It's deoxygenated, and jugular veins are taking the blood from your head down to your heart to get oxygen. Your carotid arteries sit right next to your jugular veins. Now they're arteries. They're taking oxygen-rich blood up. So the carotid arteries taking blood up to your brain, the jugular veins taking deoxygenated blood down. Arterioles are just very, very small. They're just the little side roads that deliver the blood. Again, here it kind of shows your venous and your venous system and the arterioles. You see the capillaries. See there, the venules are very small. Arterioles are very small. They go into the capillaries. See, that's where they make their gas exchange, because they get very, very, very small and they're very thin walled. Um, so that's how they are able to do that gas exchange. Veins. Something else that's important about veins. Veins actually have valves in them. Arteries do not. Arteries it's a higher pressure system. So there's so much pressure, they don't need valves. This is where you get your pulses. Your pulses come from your arteries because it's a high pressure system. You hold up your hand, everybody hold up your hand. Oh, where's my camera? Quick, easy way to find your radial pulse. Find your thumb, run your finger down your thumb, and get in front of my camera. Down your thumb, and kind of on the inside, like right on here. Gosh, trying to find that. Here we go. You'll find like a little hole. See, there's like a little hole there. Once you find that little hole, stick 2 fingers in that hole, and you'll find your pulse, and that's your radial pulse. Don't use your thumb, because your thumb, I'm not working, this camera is not working for me. Your thumb has its own pulse. So never take a pulse with thumb, because you'll get your own pulse. Use your fingers. But that's a real quick way. Run it down your thumb on the inside of your wrist. You'll find a little hole there. Press in. Oh, yeah. And there you'll find your pulse. And that is your radial pulse. And that is coming from your radial artery. Arteries are a high pressure system. Veins, the blood doesn't go as with a high pressure. So it tends to sometimes backslide. You don't want it to backslide. You want it to go to the heart, right? So that has valves in it. And look back here at the screen. You've got these little valves. And these valves is what keeps the blood from backflowing. That's why sometimes when you have you're getting an IV put in, or are getting blood drawn, sometimes they'll say, "Oops, hit a valve." Well, yeah, because those little valves, you hit them when you're trying to put a needle in somebody's vein, you'll feel it. You'll feel the vein of the heart, the valve, and sometimes it makes things a little more difficult. Alrighty, what else do we have here? We talked about the vena cava already. We got your inferior and superior vena cava. We talked about the pulse, blood pressure, taking somebody's blood pressure. Blood pressure, it measures the contraction, the force of the contraction and the relaxation, the pressure of the blood at these points. The blood pressure has 2 numbers. Usually the normal blood pressure is 120/80. The top number, 120, that is your systolic blood pressure. Um, the bottom number would be your diastolic. Easy to remember. Diastolic starts with a D, so you think of D being down. So it's the down number. Systolic is the upper number. Diastolic is the down number. Systolic is a higher number because that is your heart contracting. That's pushing that pressure through. The diastolic is when everything's contracting. It's relaxing. So that's why the number's lower, because everything's relaxed. Here's a lovely picture of your heart again. Anything here that I need to talk about that I didn't already talk about? I don't think so. All right, blood. So there's different components of blood. You have plasma. 55% of your blood is plasma. If you use a centrifuge and spin your blood down, you'll know that it's red near the bottom. It's the red blood cells, and the top portion is like a straw colored liquid. That's your plasma and white blood cells. Plasma straw colored fluid has nutrients, hormones, waste products. The serum um, is plasma fluid. And then you have also in your plasma, you have clotting factors, the fibrinogen and prothrombin. In your blood, you've got erythrocytes, which are red blood cells. Erythro, medical terminology. Erythro means red. So anytime somebody says something's erythematous, oh, their skin was very erythematous. That means it means it's red. Erythro means red. Leuco means white. Leuco. Um, so white blood cells are leukocytes. Cytes means cells. Cytes is the word for cell. So erythrocytes literally means red cells. Leukocytes literally means white cells. Different parts of your leukocytes. Now, your white blood cells, that's your army, that's your immune system. The point of your white blood cells, they're going to be in there and they're going to be looking for anything that's not supposed to be there. And it's going to attack it. And you have different portions. You've got neutrophils, you got basophils, eosinophils, lymphocytes, monocytes. They all have different functions. Eosinophils are big and with like allergies. Um, that is when you get your blood taken, have like a complete blood count, a CBC done at the doctor's office, and your white blood cell count is elevated. Typically, that's a sign that you have some sort of infection going on because basically it's your army out hunting down the antigens, pathogens, bacteria or viruses. Then you have thrombocytes, and those are your platelets, thromboplatelets. Um, and that is what helps with your clotting. They can become sticky and they help form a clot when you're bleeding. Oh, there's your lovely blood right there. When it's all spun down, you can see there's the plasma, and then you have all the other formed elements there. Um, different types of blood. Um, people are like, oh, I'm A positive or I'm O negative. And it just depends upon the type of antigens and whether certain antigens are on the blood. There's certain things like O positive blood is the universal donor. They can give blood to anybody because they don't have any of those A or B antigens on the blood cell. That's a whole hour long lecture right there. So I'm just literally skimming over that. Rh factor is kind of again kind of the same thing where it's an antigen on the blood cell. When we talk about blood gases, we talk about oxygen, carbon dioxide, and nitrogen. Um, we're on slide 23. I'm trying to look at the time, the clock. We got 10 minutes left. Okay. Different types of disorders of the heart. You could have some congenital heart defects. Congenital means you were born with it. Could be structural abnormalities like looky here, ventricle septal defect. Most common, it's the hole between the two ventricles. That's actually your discussion board post. Coronary artery disease. This is a lot of times when people have the plaque. This is where you need to have your cholesterol checked because otherwise it could form plaque and will block those arteries, and you don't want it blocked because then you're going to keep the blood flow from bringing oxygen to important things like your brain or your heart. Um, doo, doo, doo. You have different things like ischemia, infarction, angina. These are kind of crazy words, right? Angina is a lot of people have like some chest pain or some tightening of their chest when they're exercising, but as soon as they rest, it goes away, and that's just showing that they've they're not quite getting enough blood flow, so the heart's kind of complaining a little bit because it's not getting enough oxygen when they're exercising. So, but as soon as they sit down and rest, it goes away. That's Be thankful if you had that because that's a warning. That's your body saying, "Hey, something's wrong. Get it fixed." Some people aren't lucky and don't have that warning. They just go right in for the heart attack or the myocardial infarction, and sometimes it's a one and done kind of thing. Ischemia means that there's an insufficient supply of oxygen. So it's not killing the tissue. The tissue's just going to complain a little. That would be the angina where the heart's kind of, ooh, I'm kind of hurting a little. So the tissues aren't getting enough oxygen. So it's going to cause some pain or some sort of deficit. But as soon as it gets oxygen, it's fine. TIAs, those are like the precursor to a stroke, and that's if you're not getting enough blood flow to your brain. People start having some visual disturbances, but as soon as the blood flow is restored, they're fine. That's ischemia. Now, infarction means that tissue's dead. It means it didn't get oxygen and it died. So, unfortunately, myocardial infarction literally means heart muscle didn't get enough oxygen and it died. It's not coming back. It's gone. Um, that again is usually when there's some sort of occlusion, which means it's a blockage and the blood can't get through and it's not bringing oxygen to the heart. So people have a heart attack or myocardial infarction. That's a word that a lot of people get mixed up and get backwards, even in like nursing school. The difference between infarction and ischemia. Ischemia means the tissue's not dead; it's just not happy. It's injured. Infarction means that tissue's dead. Ooh, I got 8 minutes. Um, there's some blockage. That's what the plaque looks like. This is why you get your cholesterol checked, and if your cholesterol is high, you do something about it because otherwise it's going to get fully blocked like that. Um, Heart failure, congestive heart failure, a lot of fluid backup. That's where people will have the swelling, like their feet will swell, their ankles will swell. Sometimes they'll have swelling even in their abdomen. And these are different types of heart failure. And there's actually a whole lot of different reasons for this. Carditis. Here is another medical terminology that's very important. Itis. Time you see the word itis, that means inflammation. Carditis, inflammation of the heart. Tonsillitis, inflammation of the tonsils. Appendicitis, inflammation of the appendix. I could go on and on. Itis, inflammation. Endocarditis, here we go. Ooh, endo, remember that word? That was the inner lining. So endocarditis, literally three lovely medical terminology words right there in a row. Tells you exactly what it is. Myocardium. Remember, myo was muscle. Cardi is heart. So that's diseases of the heart muscle. Cardiomyopathy says it's a term to describe all diseases of the heart muscle. Um, then you have different issues with heart valves. Heart valves can do prolapse, where basically they don't close completely and the blood will backflow. When you're listening with a stethoscope, you'll hear it go psh, psh, and you know that's that blood flow back. It's a backflow. Aortic stenosis, medical terminology for a um, uh, um, uh, like a tightening or too small. I'm trying to think of the way to say this, and they don't have it here. But it literally means it's a stenosis means it's instead of it being like a large opening, larger opening, it's smaller. I cannot work this camera, guys. I'm sorry, I can't turn my hand right. So instead of it being large, if it's stenosis, it's closing in and it's too small. You could have a stenosis in your back with your excuse me, spinal column, and it causes a lot of back pain. Aortic stenosis is a very kind of common when people get older. Actually, my dad died from aortic stenosis. His aortic valve got to be very small. The opening became very small, and it wasn't having enough blood flow go through, and he needed valve surgery, but he passed away before they could make it happen. I apologize. Arrhythmias. We're doing a whole month's worth of information in 1 hour here. Arrhythmias are if your heart rhythm is not normal, you have normal sinus rhythm. You can have arrhythmias, then your heartbeat is not beating in a normal manner, it's irregular. And it can cause you to basically go into cardiac arrest. Arrest means stop. So heart stops. Here's the words bradycardia, tachycardia. Excuse me. Some different things we talked about, like the ventricular tachycardia or the long QT syndrome. That was that QRS complex that I showed you on the EKG. um, Here's some EKG strips with various things. AFib, atrial fibrillation. You can see it looks that right in there. It's supposed to be kind of straight. It's doing a boop, 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 boop like that. And that's literally what the heart's doing. Instead of the atrium contract or pushing that blood down to the ventricle, it's kind of just quivering. It's quivering like that. And you can see it. If you look really close, you can see it literally looks like a quivering. This is bad because one, you're not getting enough blood flow through. Two, when it quivers like that, it can start clotting. And when it blood clots, it could, we call throw a clot. And then that's the number one cause of stroke. VFib. VFib is a terrifying rhythm because VFib usually turns into VTAC, which is down here. Ventricle tach. You can see this is all ventricle motion of the heart. There's no atrium at all. It's all ventricle. And this is a deadly rhythm. This is ventricle fibrillation. And guess what we do? We defibrillate them. That's when we shock them. We defibrillate because we want to get rid of that fibrillation. Excuse me. Different blood vessel abnormalities, vasculitis. Remember, vasculitis is like the vascular system, the veins, arteries, itis, inflammation of. Sorry. Arteries. Here's the aneurysm. That's the weak spot on an artery, and it kind of balloons out. So you got your nice little artery here, and then you got a little weak spot, and it's going to go whoop, and you're going to have like a little lump where it balloons out. Now, they can either put, like, if it gets too large, put like a clip on it, clip it off. Sometimes they just need to watch it. Maybe it's like, okay, well, it's not really that big. It's just a little bit of fun. So let's just keep an eye on it. Meaning, like they may do an ultrasound on a regular basis. If it gets too large, then they may need to have to go in and surgically remove it. That's like the AAA, the abdominal aortic aneurysm. That's a big one right there. I have 3 minutes. Okay. Veins, you can have chronic venous insufficiency. That means that your circulation is not good, your venous circulation. That's if you're on your feet a lot and you're on your feet all day, and now you notice at the end of the day your feet are swelling. That's because your venous circulation is not it's not pulling the blood back up to the heart that well. A thrombosis, that's a blood clot. That's literally medical terminology for a blood clot is a thrombosis. We talk a lot about, maybe you hear about DVTs or deep vein thrombosis, and that's a blood clot. It's typically in the legs. I've seen them. People have them in the arms as well. But the big thing is you don't want it to travel to the lungs. That then it turns into a pulmonary embolism, and it can be deadly. Here's the thrombosis right here. Embolism, there's when it turns into where it goes into the lungs. I gotta zip through here because we've got 2 minutes. Cholesterol is the fatty substance that goes through your blood. Hyperlipidemia, ooh, another big medical terminology word. Hyper. Anything hyper means like a large amount. Hyper is it could be even too much. Hypo is too little. Like if you have hypothyroidism, that means you have low thyroid hormone. Hyperthyroidism means you would have a lot of thyroid hormone. Here, hyperlipidemia. Emia is anything with blood. Anything that says emia means blood. So it's too much of something in the blood. And there's that word lipid. Lipid means fat. Too much fat in your blood. That's your cholesterol right there. Hyperlipidemia is too much fat in your blood. That's going to clog up your arteries. We are not going to have time to talk about leukemia and anemias, hypertension, that's the high blood pressure. Hypotension, there's the word, who got the opposite, that's low blood pressure. And it's 8 o'clock. So I am going to stop, and I do not even know what else is on here. We talk, here's, oh my goodness gracious, all kinds of good stuff. Oh, okay, I think it ended. So I wasn't too far off. All right. So rest of that, just go ahead and look through it. If you have any questions, reach out to me and I will see if I can help you. Other than that, have a good night.